I'm Dr. Vinita Matthew. I'm a family physician. I'm based in Borivali, Daisar, that is in Mumbai. It's a suburb of Mumbai. And we have so my husband is also a physician. We have a hospital here, and as part of the hospital, we have started a mental health initiative. Okay, so where we want to give whole person care, we are looking at a place where people would feel, it's a place of comfort, refreshing, rejuvenation, and where the mental health aspect we are looking at from, kind of educating people to understand that when a person falls sick, it's not just about the physical health, but they are mind, body, soul, and spirit. So it's not just taking a history of the physical aspect, but also what's happening in their minds, what is happening in their social, what is happening in their community and in their families. So that's how we are looking at approaching health. And today we have with us, and this initiative is called Raahat. That's I forgot to mention that. And today we have with us a team from healthSoch Academy. We have Dr. Johan Ebenezer. We have Dr. Praveen. We also have Angie, ma'am, Angelina, and Jobin Jose. So this is the team from healthSoch Academy. I would like them to, they have a very unique style of, educating us on the aspect of mental health. I have personally uh, experienced a lot of help from Johan sir and Praveen sir when I attended their training programs. I want them to speak a little bit about themselves and then they will carry on for with this topic. The topic, like all of you all are aware, is on caring for the caregiver, especially those caregivers who are taking care of of loved ones who are going through addiction. Okay, so this is the topic for today, and I'd like Johan sir, if sir, you can just give us a brief about your methodology, how healthSoch Academy came about, and what is it that you all are going to do with us today.
Sure. Thank you so much, Vinita, for introducing and also for inviting us here. So we're very happy to be here with Raahat. And Vinita is a good friend from long time, and we are associated with her from some years now. So it's really nice that we could get together and do this thing together. So we are from healthSoch Academy. We are an organization focused on mental health teaching and training. So that's our focus area. And we work with the general public as well as with professionals. So we run programs and courses for healthcare professionals and other professionals in mental health, and also for the general public as well. So we have different sorts of engagements we do. So we have our own programs as well. We also work with other organizations to do trainings and design trainings and other things. And we also do our own, webinars, workshops, both in person as well as online. So that's the sort of things we are involved with. I'm a psychiatrist by training, and my area of interest is community mental health. Praveen here, who's also a medical doctor on our team. He is a physiologist and a neuroscience specialist. And we have Sister Angeline George. She's a nurse by training, but has also done a pastoral counseling diploma. And we have Mr. Jobin Jose. Jobin Jose is an engineer, and he is our admin and finance person in our team. So that is our team, healthSoch Academy. And we're very happy to be here with you. So as Vinita says, we use certain teaching methodologies as part of our training programs. We like to call that the Sochcast methodology. We play around with this word Soch a lot, the healthSoch Academy. Soch, those of you who know Hindi will know Soch means thinking or thought. So Sochcast is our methodology. It's not a unique methodology, but it's just something we've formulated based on many different good teaching strategies. And the particular combination of strategies that we use is we call it Sochcast. So that includes a lot of dramatized presentations. So we use a lot of drama and role play in our teaching. It also includes interactive questions. So we'll often be asking the audience to also take part by answering or questions or thinking and all. And also a lot of reflective exercises where we will ask you to reflect on things and see what you've learned, how you can apply things like this. So we will use some aspects of these methodologies in today's session also. And today's session is designed as a prelude or a sort of like the trailer for a bigger set of things coming, which Vinita will reveal at the end, a set of workshops and other things on this area. So today is only a teaser and a thing. I mean, you may not get all the answers you have come for in this big area of caring for those who are struggling with alcohol, but we hope you will at least get a good foundation and a good beginning to approach these problems. So that is how we are going to go about it. So today we will be focusing primarily on recognizing alcohol issues as a problem and recognizing what are the problems we need to deal with. That is the first step of then moving on to what can we actually do to respond to those problems. And so I think today we'll be doing the part one of the foundations, and then later on we'll be looking at other things also in the future, which Vinita will share later. Is that okay, Vinita? Shall we move into the session? Yeah. So we will have some time for questions at the end. I'll just lay out how we are going to be doing this. We will start first with a small dramatized presentation, a small drama. And after the drama, we will debrief that drama. And we'll talk about what are the things that went in that, what are the interactions that happened, what can we understand from that set of interactions. And we'll try and get some learning points from that about addiction and about being a caregiver and all these things. And we'll try to put that together. That will be our primary teaching session. And after that, we'll have a time for questions. So Vinita will be moderating the question part of that. And she has some questions of her own also, and she'll also be taking questions from the audience. So that is the time you can put in your questions in the chat box. So we'll try to answer whatever we can. And in case there's stuff we're not able to address, we can still take those questions and see how we can respond to them in other ways also, or we can take them up in the coming things as well. All right. So that is how we are going to structure today's session. And we're very happy once again to be with you. Okay, we'll move straight into the session. The drama first, let me introduce that. So 3 of us are going to be doing a short drama. Praveen here is going to be playing the role of Mr. Saurav. Now, he is a particular patient with an alcohol problem. And that much I'll reveal. He is an IT professional by background. And they have come here to see me. I'm going to be playing basically someone like myself. I'm going to be playing the role of a psychiatrist here. And I'm going to be playing the role of a psychiatrist called Dr. Rajesh Rathore. Okay, so that's my name. I'll be renaming myself also to just make it easier for you. Dr. Rajesh Rathore. Yes. And Praveen here will be playing the role of Saurav. So let me get him also up here for you. All right. And Angie will be playing the role of Saurav's wife, whose name is Suchitra. All right. We'll get her also. Yeah, she's up here. So she's Suchitra. She's the caregiver, in this case, the wife of Saurav. Now we're going to have a short 10 to 15 minute drama, basically, of a consultation, a hypothetical consultation, which might happen if both this couple come to me to get evaluated. So that much I'll tell you now. Rest you should watch in the interactions. So I'll let you know once the drama part is over. And after that, we'll get back into our regular selves and we will debrief what happened and we'll try to get some learning points from there. All right, we're going to get started. Good morning, Saurav.
Good morning, doctor.
Thank you for coming. And I think, ma'am, you're his wife, isn't it?
Yes, yes, sir.
Okay. Well,
I'm
may I know
Suchitra.
your name? You're Suchitra.
Suchitra.
All right. All right. So thank you for coming. So little bit of background information I already have. That is, I understand that you're 40 years old, isn't it, Saurav?
Yes,
Yeah.
doctor.
Yeah, and I understand also that you're an IT professional. So that much I can make out from the chart already. But I'd like to ask you to please share what are the main reasons why you've come here? And how would you like us to help?
I will wait, Saurav, I'll tell. Sir, he's an IT professional and he works for a company overseas, like US company. So he works most of the time in the night, and in the daytime, like because he's into this drinking thing, and in the daytime, like he's completely absent. Like he never cares for the family, he never cares for the children. We have two kids, and they are school going, and one is in the ninth standard, another one is in the seventh, and children have to go to school, and we have his parents at home. They are elderly, and both of them are retired, and they are at home. And my mother-in-law is almost like bedridden. She's at home, and she needs care also. Like kind of like she moves around, but she needs help. And I'm also working in an office. Like I go for working in an office. I go at 9 o'clock
Right.
and come back at 5. And children have to go to school, and I have to pick up children, drop them, and he's just work. And in the night time, like he's awake because I understand he's working for a overseas company, but the thing is like daytime, like the whole thing is on me, sir. Like how can I go about taking care of children, taking care of the in-laws, cooking, and and so he's so much into drinking, sir. Like the money and everything, like it is spent on that. And how can we absolutely like not managing the family even financially or even the other needs, everything? What can I say, sir?
Sure. All right. Thank you,
And I've been
Suchitra.
telling him to stop drinking, but he's unable to do that.
All right. Sure. Thank you, Suchitra, for sharing. So I really appreciate you for coming together. And Saurav, uh, would you like to add anything? I'd like to hear from you as well.
Whatever, doctor, it's primarily because I have this US client and it's off late. So sleep is a big issue, doctor. So
Okay.
he is
Right.
sitting and thinking, telling as if I am going to the pub and enjoying my life and having dance and party and all. I'm sitting in my room.
I
I have work to do, and that is why I often cannot sleep. Sir, you can't
Rajesh,
go
sir,
and tell
I
your
have
stories
listed a
there when
wait,
you're
wait,
going to the
Saurav,
company.
Right.
wait,
Yeah,
Saurav, wait.
Suchitra.
I have listed so many problems, and he says sleep is the only issue.
Right, Suchitra.
What
Thank
is
you.
this, sir? And I've been listing out so many things, and he says like, just sleep is the issue.
Sure, Suchitra. Thank you. Let's let him complete what he's saying, and then I'll come back to you. All right. Thank you. Saurav, yeah, go ahead, Saurav. You mentioned about sleep issues, and what else? Please go ahead.
So I have to be at my best at the peak time and all. Already layoffs are happening. We are losing our jobs and all those things. I can't tell all of these stories and all when I go to work, and I have to be at my best. So I take something before the thing also, and after the thing also I take something, and That's how I manage. I'm sitting and working over there. I'm sitting in my home. I'm not disturbing anybody. I have to work. Who is it that I'm working for? It's as if for my own pleasure. Not even going anywhere, doctor. She won't even allow me to go and leave the kids at school. She is telling I am an
Ima-
influence and things and all of that and all those
Sure.
things.
yeah,
I am
sir,
doing all
like
of this for the
people
family only.
know
Sure.
I'm the one dropping the children. I'm the one picking them up. And he is almost like drinking, and imagine him riding the vehicle, and what will the other parents think? He being wobbly and sleepy, and coming and picking up the children, and they all know that he's into this drinking habits. And what will the children and the other parents will think of us, and what will
Sure.
reputation my children will get? And I don't want them to know that he's an alcoholic father, and this is how we are running the family. And I am
Ask her,
taking the
doctor,
whole
who
thing
is the
of it.
one who helps the kids while in exams and all. All of this is there. When actual exams happen and things and all, I am the
I
one
know, sir, but
who's helping the kids
at
and
least that
helping
he
them
should
study
do.
and
How
all those
can
things
I
and all.
see that is left? At least that you're doing, but how can I even do that? I have to manage the household chores. I have to look after the elderly parents, and providing them food, cook, go to the office, come back.
Sure. Sure.
How much one person also can do?
Oh, all right. All right. So thanks, both of you. So, first of all, thanks for coming. I think it takes a lot of courage for you to come and discuss these things here. So, we appreciate that both of you are here together, first of all, and that you're here to discuss this issue. So, we'd like to help you, but for that, I need to ask a few more questions so that I'll have a little bit better idea. And then I can tell you how we can work on these things. Is that all right?
Yes, sir.
Yeah. Can I go ahead and ask a few questions?
Yes, yes.
Yeah. Yeah. So I'll ask some of these questions will be for Saurav to answer. Some of them I will require Suchitra to give input. So I'll tell you whom I would like to hear from. Is that all right? Yeah. So this is mainly to help me to understand better. All right. Sure. So Saurav, let's start with you. So I mean, both of you mentioned this alcohol issue. I'd like to know how long this has been going on.
So I've had the alcohol issue in the sense means I've been from college days occasionally go and have parties and all those things and all. So
Right.
used to drink, but that's so occasionally,
That was
periodically.
occasional. Okay.
Now uh, this is post-COVID. I got this assignment uh, with the US company and all. That's when this work from it's primarily a work from home. Very rarely we have to go to the office here,
Okay.
but it's usually here. So that was when I was finding it difficult to sleep.
Right.
And it's not only sleep, sir, you have to be at your A game, no, when you're doing the things and other things. And also,
Yes.
that's how I started taking some things with the thing. And in my room only, I used to take, and then I still could not sleep. So I, in fact, even after taking this also and increasing the thing also, would give me little energy and keep me awake and things, and also that's why I used to take. But then sleep was an issue even after that also. So all of this is happening, doctor. After doing the work and all those things, I'm struggling to sleep. My hands sometimes shaking and all those things and all.
Right.
Thankfully, it is online, so they don't see all of these things. And I have to sit and work. It's not just the meetings on the things. It is what you say. We have to do the stuff also, no? And all of this has to be done. Assignments and deadlines have to be kept and all those things. So that's how this has been. But then I am sitting over in my house, and stress is also there. It's not like I'm working and having a party of my life and opportunity of my lifetime and all to sit and enjoy and all. So sometimes I take in because I'm not able to sleep. This is not over there work. Even after I finish and do my work, also I have to finish something and all. I take and try to get energy and all, and sometimes it goes on in the morning and other things and all.
Sure. All right. So what I'm hearing from you is one is uh, after you started doing your remote work and all, you started drinking a bit more because of the stress, etc. But on days that you didn't drink, you used to find it difficult to sleep. Am I right?
Yes,
You
that's
also mentioned some tremors,
yeah,
some
yes,
shaking, and all of that. Did you
yes.
have a lot of sweating also on such days? Sweating and any tensions and all that you used to have on
Yeah,
such days
basically,
when you didn't drink?
yeah, because sleep was the thing, and sometimes I had a doctor friend who could help me, and I asked even for some sleeping pills, and I started even taking some sleeping pills also. But
All right.
that
And
also is not working, doctor. And so with
okay,
all of this, I have to again go and um, work, and
right. And
that's how I coped with the whole
so
thing.
sleeping pills plus the alcohol, and that used to help you sleep, right? And
Yeah,
reduce
yeah.
this kind of thing. Now, okay, thanks for sharing that. Now, could you tell me about roughly how much you were drinking? I mean, just to give an idea. Like,
That I used to take, and yeah, it's increased now with the thing. So I quietly take and keep
oh,
drinking,
like how
like
many,
two
like
glasses.
for example, how many ml, or at least how many glasses a day would you drink it to start with in 2022 and all?
Yeah, 2022, just a glass or something
Hmm.
must be. But then now it's like 2, 3 glasses over the whole day.
Oh, so it has increased, you're
2020.
saying. What was
Yes, yes,
usually
it has
just a
increased. Yeah, yeah.
glass a day has
Because
now become.
I'm not able to get that thing, sir. I have to be that full awake and
Okay,
energized. So
right,
I
right.
will have to increase and stock. So I
Right.
stock and keep and take that.
And yeah, thanks for sharing that. Now, are you able to exercise control on it? Like in the sense, like when let's say somebody offers you a drink in a dinner or something, are you able to say no? Or once you are drunk one glass, are you able to say I won't take my second glass? Or is it very difficult to do that?
So initially, when I used to go out, I said no, occasionally. That time I was very controlled and all. I was responsible. I wouldn't drive, if suppose if I had taken and all some things and all. But now at home, sir, some days I just can't stop. So that's how it continues all throughout the day. I just can't. Once I
Oh,
start,
so once you
I
start,
can't.
it's becoming very difficult now to prevent the second
Now,
glass and the
yes,
third glass, and it's becoming challenging. All right.
yes, yes, sir.
Yeah. And what about how you spend your time? Like, I know you're busy at work, but other than work, did you have any other activities you used to like to do with your family or on your own and all? Are you able to do all those things now?
Maybe not as much as before.
Is that because of work or is it because your drinking is eating into that time also?
Not work, because work. I mean, yeah, not because of work, I think. I don't feel like doing anything else than, sit with this thing and have a glass and, just sit and do this thing and have a relax myself. So that's why I sit
Sure.
in home. I don't go out and all. And so
Right.
this is
All
what I
right.
used to do.
Okay. All right. Thanks, Saurav. Now let me come to you, Suchitra.
Yes, sir.
Would you like to add anything to these couple of points he has said?
Yeah, so you just heard him say now, like he's unable to help with anything at all. Like, children need a father, right? He's there at home. But the thing is, of late, they are also growing and they seldom listen to me. Like, they are into this online games, and especially my son, and he cannot stop it, sir. Like how much ever, like I've been telling, and it's taking a thing on me, like, because they are not listening, and for hours, like, he just sits and watches the game, plays the game and the mobile, and he hardly stops it. And there's so much to do even at school. There is studies and tests and things like that. But unless somebody has to force him, right, and absolutely, and he's there into his room and his work and room, and I can't sleep, and he takes this drinks, and then that is also. And so there should be some, even at least my grandparents, at least they have to say. This thing is like, especially my grandfather, he's so pampering the children. He's like, I shouldn't be so strict with them. I shouldn't be, yelling at them, shouting at them. But he's there, at least they can talk to him now. They can at least tell him no. And how
Sure.
much I can tell the grandparents also, they are also not that side. And I'm really concerned about my son. And he's going to go into 10th standard. And the marks are also important nowadays. Like, there's so much of a competition.
Right.
And just like father. And if he's into this drinking, and now these kids are, getting into this habit of, online games and getting stuck with that. And he's not even realizing that children are sitting with the mobile and, not listening. And me shouting like that as if he's deaf. He can't even hear.
Sure.
Just tell me, sir. And these things, like, it is, and even he was supposed to get the promotion at work. And he says, like, he has to perform best and give his best. At least if there is a promotion or something like that, will be financially helpful now. Even when he's due for the promotion, he didn't get that as well.
Sure.
And how much to toil, sir? Like, with the price thing going up for everything, like, now it is so difficult. And how will we manage this many people at home? At least he should understand that, right? Being as a father, heading the house.
Sure. All right. So thank you both of you. That's been very, very helpful. So I'd like to just tell you what we'd like to do as some next steps. So we can certainly help you. All right. So Saurav, there are some things we'll have to discuss about how we can work on this and what we can do. And even both of you as a family, as a couple, we can discuss a couple of things about how we can move forward. But before that, I'd like you to get some blood tests done. Is that okay, Saurav? Are you okay for that?
Okay.
Because, you've been on regular alcohol for quite some time, about 5 years. We'd like to just do some baseline tests to see how your body is doing. Okay. That will just give us an idea. It will also help us to decide about the treatments we need to go ahead and do. Is that okay, Saurav?
Okay.
Yeah. So we'll get this done today itself. And we'll speak today. It will take about 2 hours to get your results and all. And then you can come back to the OPD and we can talk about the next steps today itself. Oh, is that okay?
Yes, sir.
Uchitra, that's fine.
Sir.
So we'll
sir.
take
Somehow,
that
sir, help him to stop this drinking habit.
Yes. We can help and we'll discuss about that. We'll talk about the full plan and all. But first, I need to see his blood tests. All right?
Yeah.
Sure. So once you've done the tests, you can just come and wait. Maybe you can have lunch after that and come back in about 2 hours. and then we can look at it together and we'll tell you the next steps. Okay? Sure. All right. Thank you. Yeah. All right. We are out of role. We are back to our regular selves now. So I hope you were able to follow what was going on. So let's start with just debriefing what we saw. So I'm going to ask Praveen to just screen share. He's going to help us write down some of what we saw. All right. Yeah. So obviously we saw a couple here, interesting couple. Yeah, I'm sure you all know couples similar to this. Obviously, this is not a particular couple that we know that we have put together. It's kind of like a very generic couple. So you sometimes do see couples like this. So we have patient Saurav. What do we know about Saurav? He's an IT professional. Yeah. So what do we know about his background? He's 40 years old, IT professional, very busy at work, works remotely, right? And that's an increasing challenge of our age now. We see a lot of people who work remotely. And while that's a good thing in many ways, it's also challenging because there are problems with keeping boundaries and all of that. And that's a problem here. Part of this stress is because his workplace environment also doesn't understand this idea of work-life balance. So he has bosses who keep expecting a lot of things, and that has put a lot of extra stress on him. So that is one. Other aspect is his own issue also, that he has struggled to cope with the stress and taken some not very good strategies to cope. And that has led to what he's facing. Right. So it all started with work stress. And to relieve his work stress, he started drinking. Now, interestingly, he was not a big drinker. In college, he used to be an occasional drinker. There's so many people like that. So there's nothing abnormal, no red flags about his story until COVID. And in COVID, to deal with stress, he started drinking a little bit more. Finally, it became 1 glass a day. And then it became a bit more than that. And now it's somewhere around 3 to 4 a day at least, maybe more. But it has steadily increased, right? And it's become regular and it's increased. And there are some other interesting things we're seeing here. We're seeing he couldn't sleep without drinking. So you're seeing that as a new change that is coming, right? He is finding it difficult to sleep without drinking. So much so that he even has to take sleeping pills in addition to alcohol sometimes to sleep. That was not a problem before. But now it's become a problem. He doesn't drink. He can't sleep that day. He has shakes or tremors. He has sweating. He feels very tense, restless. So he needs to take the alcohol now to stop those symptoms. That's another new thing. We've also seen, as I've mentioned earlier, that increased amount of thing that has steadily increased now. Now, to get the same effect as he got at the beginning, he now needs 3 or 4 times that amount of alcohol. He described it nicely. He said 1 glass earlier, now I need 4 glass, 3 to 4 glass. So there's that increase there. To get the same effect, he needs that much more alcohol. You're also seeing that steadily he has reduced the activities he's doing. No leisure activities anymore, no social activities. All the free time is going in drinking. And not that he has much free time anyway, but whatever free time he has, he's instead of doing some leisure activity or some productive activity or spending time with family, he's drinking in that time. So we're seeing that also happening. Increasingly, alcohol is taking prominence over other, activities and pleasurable activities that used to be there. We are seeing less of other things, more of alcohol. We are seeing that coming in. Right. Another thing we are seeing is, he mentioned he's finding it difficult to put limits on his drinking. This was not a problem he had earlier. If you remember in college, he was very happy to drink occasionally at a party and then not drink for months after that. So it's not a person who didn't have the capacity to control. But that has changed now. And you're seeing that once he starts drinking the first glass, he finds it very difficult to restrain himself from the second, and so on and so forth. You're finding a difficulty in controlling, which used to be there. So there's a loss of control. So we're seeing all of these peculiar characteristics about his drinking patterns. Now, each of these is actually a criteria for dependence. All right. Now, that's one of the learning points of today, to kind of learn what are some of the criteria for dependence. How do we recognize a person who's just a drinker occasionally from someone who has an alcohol problem as such? And we like to call that we like to name that as dependence, because dependence is a more specific and let me use the word scientific label, because we have some defined criteria for dependence. The word addiction has become very vague, unfortunately, and often it has got a very negative connotation also. So the word addict we often use in a very pejorative, negative way, and we sometimes use it very loosely. Oh, he is an addict. He might drink once a year, but we'll call him an addict. So that has lost a lot of its actual meaning. So that is why I'd like to prefer to use the word dependence here. And for dependence, we have some very clear criteria. All right. So those criteria, there are at least 3 sets of criteria. Okay. I'll name them for you, and then I will also describe what of those we saw in the story. All right. So that you'll be able to see how we could recognize that Saurav actually has dependence. Now, I know when we hear the story, deep down inside, we know there's a problem. Kuch to hai, there's some problem with him. And we know that he's got a drinking problem. We know that. But how do we quantify that? And how do we actually say, no, he's not just an occasional drinker. He's now a person with dependence. And that is where these criteria will kind of help us to distinguish. So what are the criteria? There are 3 groups of criteria, and I'm going to name all the 3 domains, and then I'll explain them. So the first domain is called neuroadaptation. Don't worry with the term. I'll explain everything. All right. So, neuroadaptation. All right. The second term is called salience. Salience or primacy. Okay. Salience or primacy. And the third criteria is called loss of control. Okay. Now, each of these have very specific meanings. And when you understand those meanings, it becomes very easy to pick up the criteria. All right. Now, under neuroadaptation, which I'll address first, there are 2 subdivisions. Okay. And they also have names. So let me tell the names of the subdivisions. The first one is withdrawal. Okay, withdrawal. And the second one is tolerance. Okay, so don't get scared with all these words. I'll explain everything. Yeah. So under neuroadaptation, what does the word neuroadaptation means? Neuroadaptation means the nervous system of the body, the brain and rest of the body, have slightly changed or modulated because of chronic alcohol use. Now remember that alcohol is basically a chemical. We are drinking a chemical that goes into our body. And once in a while you drink, it's okay. But then when you have sustained long-term exposure at high levels, that has an impact, a long-term impact on the brain and the nervous system. They slightly alter their functioning. That's why it's called neuroadaptation. All right. So this can happen in at least 2 ways. The first of those is withdrawal. Now, withdrawal, as the name implies, is when you suddenly stop alcohol, you experience certain physical symptoms. That's called withdrawal symptoms. So a person who's been dependent on alcohol, suddenly you stop or drastically reduce the amount. The person may have insomnia, difficulty sleeping, or they may have tremors, which is a very classic symptom, or sweating, or sometimes they might have some racing heartbeat, They may feel very anxious and tensed and restless. So these are pretty common symptoms. A lot of people who are alcohol dependent experience these sort of symptoms. In some patients, those might become very severe also, and you might have serious issues like seizures or confusion and all these things, which are quite serious. Those are rare, but they are present. You do see them in something like 10 to 15% of patients. You might see these severe symptoms. But majority, that's about 85 to 90% of patients will experience only the common withdrawal symptoms without the severe ones. All right. So that's withdrawal. That's one set of things. The next neuroadaptation is tolerance. Now, tolerance doesn't mean what we normally mean in English. In tolerance, when we mean in English, we usually say, I tolerate him. I don't like him, but I'll tolerate him. That's not what we mean here. In medicine, pharmacology and medicine, when we talk about when you take a particular medicine or drug, if you need to keep increasing the dose of that medicine to get the same effect, that is called tolerance. All right. So it's for medicines, for drugs, for substances, alcohol, everything. Certain medicines or drugs have this property that the dose needs to keep increasing in order to get the same effect. That effect is called tolerance. So that's a symptom in people who are dependent. Now, let's say on alcohol, here we are talking about alcohol. So the person initially starts with one peg. Then after a couple of months, that one peg doesn't touch him only. So he has to make it 2. Then he makes it 3. After some time, even 5, 6 pegs or a full bottle also, he is still standing straight. No problem. That is called tolerance. Now, if a normal person who doesn't have this suddenly takes 6 glasses of alcohol, it will be deadly to him. He might even, collapse and he might be in serious trouble. But then a person who's got tolerance can have huge amounts of alcohol, no problem. Yeah. Okay, so that is tolerance. So these two together are called neuroadaptation. Now let's move to the next criteria, salience or primacy. This basically means the most important thing. The word salient, it comes from an old English word meaning fort. The word salient, that meant a fort or a fortification, that kind of thing. So obviously we only fortify important cities or areas and all. So when you give a lot of importance to something, we say it is a salient thing. Okay. The other word is primacy. Primacy is an easier word to understand. Primacy is like the most important thing. You can use either of these words. Generally, I like the word salience because it's a picturesque word. Yeah. So basically, drinking becomes the most important thing more than anything else. All other activities take second place. Like in this case, he's not doing any leisure activities, no social activities, nothing with his family. All second place. And alcohol has taken up the primary place. That is salience. And the third one is easy. That's loss of control, meaning he's not able to say no if somebody offers him a drink, or not able to limit the amount he drinks. That's loss of control. Now, to say a person is dependent on alcohol, we need to have at least 2 of these. Out of these 3 groups of symptoms, we need at least 2 to be present. And that should be there not just for 1 day, 2 days, it should be there for a prolonged period of time, like a year or more, before we can actually say a person is dependent. So that's why I'm saying we should be a little careful in loosely saying somebody's addict and somebody's this thing. First, see if these symptoms are there. But this is where an evaluation is helpful. Now, I don't expect that all of you will be confident after this one class in identifying. But then we'd expect that at least you would be able to identify and refer, so that a professional can help to distinguish these things. But that's just to help you to know. So you need at least 2 out of these 3 for a prolonged period to diagnose dependence. Okay, so you can have a person who has neuroadaptation, that is either tolerance or withdrawal, or both. Even one of them is there, that's enough to say neuroadaptation is there. So you could have a person who has neuroadaptation as well as salience, but has no issues with control. that person is also dependent. Or you might have a person who has only salience as well as loss of control, but has no neuroadaptation issues. That person is also dependent. Or you can have all the three domains. Okay, so that's the criteria. So as we can see, our friend Saurav has actually all of these things. If you notice, I'll ask Praveen to go back up to what we wrote about Saurav. So not able to sleep without drinking and even taking sleeping pills, that tells us he has withdrawal symptoms because he's not able to sleep. He has tremors and shakes and all without alcohol. So he has withdrawal. He has increased amounts of drinking. From 1 glass, it has gone to 3 to 4 glasses. So there's tolerance. He's got that also. So enough evidence of neuroadaptation. Both are there. Tolerance and withdrawal. Then there's salience as well. Less activities. Drinking has become the primary activity. And he has difficulty in controlling the amount. Once he starts drinking, he can't say no to the next glass. So there's loss of control as well. And all of this has been there for at least a couple of years. Right. So he's definitely, we have no doubt, there is alcohol dependence here. Okay. Now this is about him. What can we do to help him? Well, a lot of things. The first thing to talk about is we have to do something called detox. So the treatment of alcohol dependence actually comes under two headings. There is the detoxification part, and then there is the de-addiction part. All right. Now, both are slightly different. I know sometimes we use this interchangeably in regular English. We say de-addiction for everything. But there is a difference, and I'll explain that. So the detox period, the detoxification period, as the name implies, detox. Toxin means poison. So detoxin means removal of poison, basically. That's the what detoxification actually means. So the idea is you're allowing a time period for the alcohol to be completely removed from the body and its effects also to kind of reduce. So that's why we call it detoxification. So this is a period of about 1 to 2 weeks, usually in most people. And the idea in alcohol dependence is, alcohol detox is you give time for the withdrawal symptoms to get better. So why is it 1 to 2 weeks? Because 1 to 2 weeks is the period of usual withdrawal symptoms. So in this period, we have medicines and all that can help them to deal with the withdrawal. And we'll taper off those medicines and stop them. And we have some other things also we need to do. So the detox period is primarily about that. The de-addiction period is after that. Now, after a person is off the alcohol, say, and is no longer experiencing withdrawal symptoms, we've successfully managed that. The next part is how do we prevent him from again drinking, or how do we work on preventing relapse? So that is where de-addiction comes in. And most of the work in de-addiction is non-pharmacological. It involves a lot of counseling, self-help strategies, sometimes you have to work with the families also and do that. And of course, even group work and things like this. But it's non-pharmacological work that is the primary work. There is a minimum role for some medicines and all, but the real work is non-pharmacological. All right, so that's just one thing to keep in mind. So that's the treatment part for the person. And just to introduce that, and there are lots of different non-pharmacological things we can do. We won't be touching on that today. Lots of different counseling techniques and all, which are there. All right. But today we want to focus on another aspect also, which is why we called all of you here, which is about the caregiver. Right. And the caregiver, how do we take care of the caregiver? Yeah. What are the caregiver struggles which are there? All right. Now, as I mentioned, caregivers can obviously have a lot of struggles. And you saw Suchitra, she's a case study of all sort of problems which may be there. So let's look at Suchitra and see what are some of the things she has struggled with. Why don't you put it in the chat box? I'll ask you to think now and tell me. What are some of the things you've seen Suchitra struggling with in this story? You just put it in the chat box. Anyone? Would you like to? What are Suchitra's problems that we've been seeing in that? Okay, yes. Meena says high stress, definitely. Margaret says problems with balancing many roles. Okay, and it's a good point. Yes, he's got 100 things to do. And there's been, because of his being absent from the home, interestingly, he's in the home but absent. It's interesting. But that has led her to have a larger burden of some of those areas. Stress already mentioned. Okay, burden of parenting and disciplining has disproportionately fallen on her. She's talked about her own struggles, and again, lots of you have mentioned stress and overwork and things and all. And husband not playing a role in domestic areas as much as he should. So she's stressed, she doesn't have time on her own. Yeah, good. So you brought up many issues here. There's also some other caregiver burdens she has. She's also involved with looking after elderly parent. She's also looking after the kids, and kids are having their own issues. Right? We saw all of that happening, and she's having to handle all this on her own. All right. And she's obviously angry and having those kinds of struggles. So interestingly, you're seeing. Okay, I can see another comment here, very nice one about the feeling of shame. The feeling of shame about what other people will think of the family, what people will think of husband, and all of these things. What will the kids' friends think about the story and all of that? So good. I think you've brought up many points. And interestingly, this is not a home where there is domestic violence and there is no affair going on. Neither of them are hitting each other, and neither of them is doing any kind of very brash, horrible things. If you look from outside, seems fairly stable home also. But you see a lot of hidden struggles on both sides. And you see that, right? Even the alcohol didn't come in a vacuum. And the thing is being perpetuated in a very silent way. Nobody would guess looking at it from outside. And that's what we wanted to bring out there. Now, obviously, there's big marital problems. One of the partners is having an affair. The other is beating the other person up and all of this. It's very obvious. But, even without those obvious dramatic things also, you see some families with lots of hidden struggles and the role that caregivers also, have to go through. Right. So who is a caregiver if you have to ask this question? So the caregiver could be any person basically who is involved or taking part in caring for the patient. Say, all right. Now, if the patient is, a child, then obviously parents are the primary caregivers. For adults, very often it is the spouse. If it is, sometimes it may be a sibling or it may be a friend. Sometimes it may be parent also. Sometimes it might be children. Once you get to much older adults, it might be the children who are caregivers of the person. So it's not a specific demographic that, it should only be the spouse or only the child. Anyone who steps into this role of being responsible and caring for the person involved is a caregiver. And all caregivers experience varying levels of issues. Now you can see effects would be coming. In this case, it's spouse. If another person was there, it was a friend or a colleague or a cousin or a parent, you would have seen maybe slightly different dynamics, but still you would have seen a lot of struggle and strain. Yeah. So the important thing here is that when we deal with people who are having substance use problems, alcohol and other substances, it's never usually just a simple issue of one person. It's often the entire family that is affected. And part of the management of this is to deal with the problems of the caregivers also. Now, caregivers can sometimes, contribute in another way also. In some, not in this case, but in certain families, you do see something called enabling behavior. And I'd like to just briefly mention that. So, what is this enabling behavior? You have some caregivers themselves who might be perpetuating the drinking patterns in a number of ways, either by encouraging, that's one way, or by not, by allowing, that's the other way. We're not encouraging it, but letting it happen and actually not helping with getting him to get help, or sometimes even blocking that by saying, no, it's okay, and things and this. And so it may happen in both ways. You can have an enabling caregiver who might actually be the one who's encouraging him on one side, or if not actively engaging, at least passively allowing or allowing the thing to remain the same way. So that's another way in which sometimes the caregivers may actually be a problem, and we may need to deal with the family and caregivers in that respect. That's a different perspective. Unlike Suchitra, that's not the case in Suchitra's story. There are all sorts of different caregiver experiences which are there, which we can look at. And all of these are areas where family dynamics plays very important part in the outcomes also. Because if we don't deal with the caregiver's problems, that leads to a reverse problem for the patient also. Now, one of the problems in this story is that you have an angry caregiver who's also always shouting at you. Now, if you notice that, who was the more aggressive person in today's consultation? We often think that it's always the alcoholic person who is aggressive. But if you look at it, today, she wouldn't even let him speak. She kept coming in again and again. And in fact, the Dr. Rathore had to keep telling her, thanks, give him a little space to speak. I'll come back to you. And you saw that happening repeatedly. So, that can also be stressful for the person and be another reason why he's, in a loop. So it can be all sorts of, issues that we need to look at. So we need to look at it don't look at it in a one-dimensional way, but we need to look at it as a complex issue that it actually is. Alcohol dependence is a tough one, and it's a tough problem. It's a complex problem and needs to be dealt with in a holistic way. And we need the families to be also involved. At least that's what we believe. There are other schools of thoughts who say that, no, we isolate from the family and things and all and do, but we don't really subscribe to that. We would prefer that we do this along with family, because that's very important, both for the patient as well as for the rest of the family. Doing this holistically together is very important. All right. I think we've debriefed nicely. We've got a lot of points there. It's time now for us to open it out for questions. And let me hand over to Vinita to take us through the question time.
Yeah. Thank you so much, sir. This was really, really helpful. And I'm sure everyone, all the participants also would have felt the same. So before I hand it over to the participants, I would like all of you all to please put it in the chat box or unmute later. But I just wanted to ask a little question, because we also realize that nowadays, especially youngsters, could be even adults, not necessarily just youngsters, but into gaming addictions. So this is something which parents are challenged with teens, young adults. So how would we, fit it into a similar kind of you've given us a brief about alcohol and substance abuse. Can you just give us a little bit about that also?
Thank you. So the question is really about gaming addiction and these non-substance addiction. So we have a name for that. We call it behavioral addictions.
Yes.
And they are a big group of issues ranging from simple things like screen addiction. It might be simply uh, being addicted to doom scrolling, something as simple as that, to different things like pornography or internet addiction and others, or gambling and all sorts of things. So all of those, if you notice, are behaviors. They're not substances. But the patterns are very similar to alcohol addiction. You can actually identify similar analogies to these three criteria. So you can find for example, let's say someone who's gaming. You have a guy who's gaming, you stop his gaming, he gets very restless and he can't do it. It's an example of something like withdrawal. Or gaming has taken over everything else in his life. And so it's like salience and he can't control it. Initially, he could do 1 hour and stop. Now, once he starts, he can't stop. So you get an analogous picture to how the substance addictions are. You get similar sorts of symptoms here also. So they are really addictions in a very similar manner and often need to be helped also similarly. I think that's what I'd like to say. And in today's story, we had a little bit of that also. We had one of the kids, or both the kids, who are now on screens, and one of them is into gaming. And Suchitra made a connection also. Look, they are also behaving just like him. And there's some truth in that. Yeah.
Right. So they will also need a similar kind of, plan of action for helping them to, I mean, it cannot be like a detox, but a detox in a
Yes.
different way.
Yes, exactly. It won't be obviously exactly the same because these are not drugs. So you may not get as dramatic withdrawal symptoms and all like you get. You won't get seizures and all if you stop having a game. But you get the idea. It is analogous.
Yes.
The role of medicines is very limited, and yeah, some research is going on that. But there are no defined guidelines yet about roles of medicines in these. But there are very good non-pharmacological things, very similar to how we would deal with alcohol or anything else. And even in the medicine front, there is some researches and all going on, and some people even using also. But it's a pretty new area.
Right.
Especially screen addiction and gaming and all has become a big clinical problem only in the last 5 to 10 years.
Yes.
In fact, when we were training, it was not even something we thought maybe would have read a paragraph in the textbook. But in real life, you hardly saw this. But today, everybody is talking about it. So it's a dramatic shift now. Now these have become real big challenges.
Right. And one more question is, thank you so much for that. One more question was, if, especially when people say, oh, I'm doing this because I need to relax today. I've had a tough day at work. This is just a recreation. Or if they are saying that, like, for example, when Saurav said, I needed to sleep, I need to get some sleep. So this is for sleep. But on the other hand, the caregiver is saying that it's almost like a character issue. He's not changing. This is how he is.
Right.
So how would you address this as a doctor?
Okay, it's a great question. And this is a big debate. All right. Is alcohol really a disease only? Is it something that you can't help at all? Is it something like diabetes or even other mental disorders like schizophrenia, bipolar disorder? Is it like that? Or is it something more of a moral problem? Is it somebody's fault that he's drinking? It's an ongoing debate. And, there are people, prominent mental health professionals on both sides of this debate. It's not a settled debate. But I think you would say that it's more complex than that question. So is it a medical problem or a moral problem? And I think it's not a simple answer always of it's only this or that. I would say it's both. Why is that so? Because you see, nobody forces anyone to start drinking. It is a decision that you take to drink. Right. So in that sense, there is a personal choice involved in drinking. There is a personal choice involved when we scale up our drinking. There is a personal choice involved also in continuing drinking and in deciding to stop. So choice is playing a role. However, having said that, when somebody becomes dependent, it's no longer just an issue of choice. There is the whole neuroadaptation, like we discussed, and things and all that make it very difficult to, so not impossible, but very much more difficult. So I think the medical biological angle of this makes it more difficult to deal with, but it's not. Personal choice is still playing a big role. And that is where you need to be a motivated patient to stop. The first job we have to do is motivate patients to want to stop drinking. And that's the whole set of counseling skills we need for that. Things like motivational interviewing and other types of counseling are there to help patients make this choice about whether they should stop drinking or not. And then if they've made the choice, then we can help them. It is not an easy process, but we can help them. But if they're not even making the choice, we can't do anything. We can't, you can't go with a gun and say, stop. So he has to at least make a commitment that I'd like to try. And then we can help him out with that. So the answer is, I think it's a both and, it's not an either or. It is a moral problem in the sense it's a motivational issue. You need to have some level of motivation to want to stop. It is a medical problem, yes, because chronic alcohol use does create changes in your brain, and that makes it more difficult to stop. Not impossible, but more difficult. I hope I answered that.
Yes, that's very useful. Yeah, thank you so much. So now I'd like to open it up for any of the participants who would like to ask any questions. If there are questions, you can unmute and ask. Or I think there's one question by Annie. Is alcoholism having any genetic link or a particular personality trait?
Right. Thanks for that. So like I said, alcohol is very complex. Yes, there are some, family history does tend to predict whether people will be more likely to become dependent. But I don't think it's always just a genetic problem. You could also argue that people who grow up in alcoholic homes tend to just imitate the behavior of those they see. So whether it's more of a imitation and social kind of modeling and that kind of thing, or whether it's genetic, difficult to really tease out. But yeah, it is true that, alcoholism does tend to run in families also. That does not mean that somebody who's never had an alcoholic in his family will not become alcoholic. So please, let's not look at it that way. So to answer your question, yes, there may be a genetic contribution, but it's not only that. You can have a person with no family history also becoming dependent. And you can have people who grow up in a strong family history also who don't become dependent. So it can work both ways. Yeah. I think there's some more questions coming in, Vinita. Yeah, you're mute.
Yes. So is it, how can a caretaker communicate when he is not willing to change according to the doctor's advice?
How can
the caretaker communicate when the person is not willing to change according to the doctor?
How can he communicate to the patient, or how can he communicate to the doctor?
To the patient.
All right. Great question. And I think that will take us to next session, out of syllabus for today's session, because we don't want to overload you with too much information. There are a lot of things we can do to kind of communicate better and encourage, motivate, and not be an enabler in those things, which we can take up later. Yeah. Sorry, but we'll have to wait for the next.
That's for the workshop. Yeah. Okay. Yes. So can a person who has been an alcoholic for some time, can his brain function normally after he has stopped drinking?
Yeah, another great question. All very good questions. Yeah. So to answer your question, there does seem to be some long-term changes which are there. Not all of these fully reverse also. Okay. And that is why we have to be careful to make sure he, is careful about not relapsing or not getting back into it. Because once you start drinking regularly, again, all the mechanisms will again activate. Again, you will have withdrawal, and that will be difficult to stop, tolerance, all those things. So there seems to be a long-term impact on the nervous system by chronic alcohol use. So I hope that, but that doesn't mean they can't function normally. That's why we stop drinking and get them off it, and then they can function normally till they start drinking again. So that's the thing there.
Right. Yeah. So definitely it has an effect on the body. So that's the reason why as caregivers, we want them to stop as soon as possible. Right? Yeah. So how can the caregiver deal with a person's alcohol dependence when the person doesn't think it's a big issue? This is
Okay. This is, again, I think it's similar to that previous question. So I think we'll club that with the workshop. Yeah.
Correct, workshop. Yeah. How to face criticism and still care for the person.
Right. So again, I think it's similar there. One of the things to remember is, I think understanding dependence is a very good first step for caregivers, because it helps them to also understand what the patient is going through. Now, often when you hear a story like Suchitra and Saurabh, our natural human tendency is to automatically empathize with whom? Automatically, our empathy channel goes directly to Suchitra. We don't question it. Correct. 99% of us will automatically empathize with Suchitra and will demonize Saurabh in the story. That is our natural tendency. Now, those who know a little bit more about dependence will probably not have such a dramatic thing. It will still be, you'll still be more empathetic towards the caregiver, but you at least will not demonize the patient that much. You will come somewhere in the middle. You will also start seeing some problems with the caregiver. So you'll get a slightly better way to approach this. And I know when it becomes personal, it's a different story. But still, if you understand that person is having dependence, and maybe this is why this is difficult for him to stop, it just becomes that much little bit easier to deal with it and to face problems and things and all. And remember, criticism goes both ways. Today's thing, who was criticizing whom? So it can go both ways. And sometimes the caregiver's criticism worsens the drinking. Sometimes the criticism of the the patient worsens the caregiver's issue. So it's an issue. But I think the first step is for everyone to understand first what is happening. And then we can talk about how to speak better, because that's how it starts. If we don't even have an understanding, there's no foundation on which to further communicate. Yeah.
Yes, very true. Yeah, and that's why we need to understand the family dynamics. It's not one size fits all. You need to understand the scenario, what's happening at home. And yeah, thank you so much. Does a person having mental illness also make them prone to addiction?
Good question. Yes, it can work both ways. A person who's alcoholic, say, is more likely to have certain mental health problems like depression, anxiety, schizophrenia, psychosis, and all these things. So that alcohol itself may contribute to those developing. The other is also true. People who have mental health problems like all of these may also are more likely to use alcohol. They often start with using alcohol as a self-medication. You often see this. Something similar to what happened in Saurabh, though not really. Saurabh was stressed, and the alcohol was a self-medication, really. Right. He didn't really have an anxiety disorder or something, but he was stressed, and he started using it as a balm. You know, when you have itch, you put a balm to feel better. Something like that. He was using the alcohol as a balm to get better, and then it perpetuated and became a problem. So it's even worse in those who actually have anxiety disorders or depression or psychosis and all. The alcohol can actually, in the beginning, it seems like a nice medication, sort of makes things feel better, but then it gets worse with time. Yeah.
Yeah, I'll just ask Annie to say, because there are a lot of questions, so maybe Annie can speak up now.
Yeah, actually, Doctor, you addressed the genetic connection, but what about personality trait of inadequacy? Is inadequacy always responsible for alcoholism? A feeling of inadequacy?
Yeah, not necessarily. There are many described personality types and traits that are more likely to have alcohol. So it's not just one kind of person. So you can get, for example, people who are very overworked and or very that what we used to call type A personality, very on the move all the time and stressed. That is one group who might go there. Another group might be this what we call novelty seeking group. A group of people whose trait is always I want something new all the time. I need excitement. The ones who need dopamine kick all the time. That group is also very likely to go into any kind of addiction. And so on and so forth. There are various personality types which are there. Inadequacy may be one, because again, they're looking for, they may be looking for ways and means to feel better, and therefore they.
So you're talking about the people who want to switch off from the stresses or whatever.
Yeah.
Right?
Yeah. So there are a variety of different personality types and traits that may be more prone to alcohol use. And sometimes we have to deal with those underlying personality issues also as part of the therapy.
Right.
Yeah.
Oh, thank you. Thank you so much.
Thank you. There's another question is, what if there is no family support or financial support?
Okay, great question. Now, obviously, if we have family support, we should use it. But many people are single or live in broken homes and don't have support. Very interestingly, out of all the available treatments for alcohol, one of the most successful, some would say the most successful, has actually been Alcoholics Anonymous.
Yeah.
I know we talk a lot about detox and de-addiction and treatment and therapy, and all these have only very minimal, they have effects, but Alcoholics Anonymous has very good effects. It's one of the most successful of these various treatments. Why is that? Because there is a social connect which happens there. So we'll talk more about it in the workshop and other things like that. Yeah. But these groups, being in a peer group of people who share similar struggles and have similar goals, plays a big role. So we can look for organizations like this in our local areas and connect people who don't have family support. Even if they do have family support, still it's a good thing to connect them to such groups.
Yes. What are some practical ways caregivers can support a loved one recovering from substance abuse while also taking care of their own mental and emotional well-being?
Yeah, this is the question which will be answered in the workshop. Yeah. Yes.
Thank you. How can parents and the school partner to support digital detox? We need to clarify parental role, as restricting screen time often leads to tantrums at home, while the impact, that is lack of focus and poor academics, is seen in the school.
Right. Great point. And I'm glad that has come up because this is itself a important thing to talk about. So again, step one is awareness first. So both parents and school and kids, all three, need to be aware of this problem.
Right.
And like always, prevention is better than cure. So the first step is to establish some protocols for this. The banning is never usually helpful. I'll just take a minute to one small history class. Vinita knows I love history. So, so whenever in history they have attempted to ban substances, including alcohol, it has never really worked. What has happened is banning tends to make things illegal. So, see, one of the problems why this is always another back and forth debate with policymakers and health professionals and all. When I ban a substance, the policymakers often think that's the solution. But the problem is all that happens is it becomes illegal. So what has happened to narcotics and all is that narcotics are illegal. So therefore you have to do illegal things to procure them. That's why you have mafias and you have thugs and you go and pay extra money and illegal trade and all and get them. Why don't we have all that with alcohol? Because you can just walk to the nearest store and buy it. So you don't have to do illegal things to get it. So, but once you make something illegal, people will do illegal things to get it and will get it anyway. So this happened with alcohol also at several stages, especially America. America is one country that experimented several times with the prohibition of alcohol. And in its, particularly in the interwar period between First and Second World Wars, they made a major attempt to ban alcohol, and it backfired tremendously because all the mafia gangs and all began selling alcohol, and crime rates went up. And finally, they reintroduced alcohol. They said, let's make it legal, and then things got under control. So the point I'm breaking there is it's the same here. You ban phone means nothing will happen. They'll just do illegal things to get phone. And that will make it worse. So banning is usually not the solution. The solution is actually creating boundaries, timings for doing it. Get kids used to structured screen time, supervised structured screen time from the beginning, rather than banning it and making it look like some forbidden fruit that they should run and try to get. So prevention is better than cure, definitely. Once we have identified a kid who is addicted, I think we need some more professional help and all for that. So that we can discuss later. Yeah.
Right. What can a doctor advise the patient is physically attacking the caregiver?
All right, that's a good point. If there is physical, not just here, physical attack of any kind, it's something that should not be taken lightly. They should seek help. Help is available. And, one good place to go to is actually the medical authorities. If you're afraid to go to the legal places directly, you can actually go to hospitals, and they are a place where these safely can be shared and told. And hospitals are also duty bound to protect and inform the law about the lawgivers, the law enforcers about these things. There are medical legal things and all which can be done. That may be one smoother way if you are afraid to go directly to the police. But if this, nobody should sit and struggle with this either way. And by the way, this is not only a problem for women. It's a misunderstanding that men don't suffer this. There are homes where domestic abuse goes the opposite way. So whether it's male or female, if you are a victim of abuse of any kind, reach out for help. Help is available in a variety of places. Yeah.
Yes. What if the person is not willing to seek help? Then what steps should be taken? That means the person in addiction.
Right. So, So we do have certain counseling skills for exactly such patients also. It's called motivational interviewing and other things. So one good way is to try to get them to at least go and have a chat with someone. And one of the steps we tell in one of the principles in motivational interviewing is actually don't force the patient. Correct. The role with resistance, it's called. That if person doesn't want to stop, you say, okay, don't stop, let's just stop. Or something like that. We're trained in how to attempt these conversations. So it is very difficult. Now, like I said, end of the day, this is where the moral aspect of this story comes in. There is a choice also involved. End of the day, whatever wonderful treatments and money and everything we have, person is not interested, it's very difficult. So it is an effort we make to try and make the person get involved. You can't force someone to stop. Even if you force, it's only temporary. So long-term gains can only happen if someone engages willingly. So that is the first thing. Yeah.
I think I'll stop with this last question. How can a caregiver recognize the difference between occasional drinking and signs of developing alcohol dependence?
That is why we taught you these symptoms. Okay. Occasional drinking versus this, use the symptoms. Use the criteria we have discussed. That will help you differentiate. All right.
Yes.
And if you feel you're confused about it but have a doubt, approach a professional who can help you distinguish them. There are many. Of course, psychiatrists are there. If you don't want to approach psychiatrists, there are psychologists, there are family physicians. Many nurses are also well trained in this area. So if you can approach a professional to help you distinguish these if it's not obvious to you. Yeah.
Right. Thank you so much, sir. This was really very helpful. I would like a few more minutes with all of you all just to announce that we are following this webinar with a workshop. So the workshop is planned as a 2-day workshop where there are many questions that you'll have asked in the chat box, and it's all going to be covered during the workshop. It's a 2-day workshop, 1.5 hour each day. So we're going to, of course, it's a paid workshop because we're going to teach you all some tools. So it's not just for people here, but if you know people who are in this caregiving background, whom you know with they're challenged with someone in their household or their family or their friend who's having such problems. So please forward this to them. I will be making this recording of this session available to all of you all. You all can forward that along with the registration link. So if you all can fill in the registration link and please reach out to me. I've already put my number in the chat box. I've already put the link of Dr. Johan and team, the whole entire healthSoch Academy. They've got some amazing material. I have personally experienced it. And it's really wonderful how they communicate these important topics, the topic aspect of mental health. So I'd like you all to go through that also. And if it is possible for some of you all to turn on your cameras, it would be great to just have a picture of all of you all before you all sign out. I want to God bless you all, and I hope this was, yeah. Thank you. I'll